Prakruthi. This is Dr. Kalpanasringar from Prakruthi Charitable Foundation. Welcome to my channel, Tuning a Fragile Mind. Today I am going to briefly talk about OCD. OCD, the expansion of OCD is Obsessive Compulsive Disorder, which is commonly seen these days, especially because of the pandemic. There are many people going through OCD symptoms because they are very frightened about the coronavirus. Now, how do we deal with these people, and what are the symptoms and what are the causes will be explained to you today. First of all, let me tell you that anybody from any age group can get OCD symptoms. Even children between the ages of 10 and 15 could also experience it. Of course, adults can also get it, but the severity of the symptoms could vary. Some people may experience very mild symptoms, some people can experience moderate symptoms, some people can experience very severe symptoms. They get obsessed with something because of severe anxiety and stress and a fear that something is going to happen. You must have seen people locking the doors, checking, rechecking whether they have locked it properly. This is also an OCD trait. There are some people who go on washing their hands often. They wash and it goes to such an extent that they start counting. I washed it once, twice, thrice, it goes on. This is also an OCD symptom. There are some people who make you repeat the same thing over and over again. They sit in front of you and they make you repeat and repeat and repeat. That's also an OCD symptom. So certain obsessions become compulsions. So when obsessions become compulsions, it becomes very difficult to treat these people. In the pandemic, of course, you get those voice messages saying that you have to maintain social distance, you have to wash your hands with a sanitizer, you have to wear a mask. There are some people who wear 3 or 4 masks, one on top of the other. There are some people who constantly are in front of the tap, or they have the sanitizer bottles with them, huge ones, big ones, and they go on washing their hands. It is not required. If you don't touch anything, or if you don't see any person in front of you when you're sitting alone, you don't need to use this so often. The idea behind me telling you this is because people do not understand what we're trying to tell them many a times. They just listen bits and pieces here and there and they start acting. I can give you an example of a very good case that had come to us long back. This lady had an obsession of taking a bath using 50 sachets of shampoo, just going to the washroom and coming out, going there and coming out. She never used to even change her clothes. She used to just pour buckets and buckets of water and she used to come and lie down on the bed. That day, by chance, I was sitting in front of the closed circuit cameras and I was watching. I saw something red on the white bed. I got very worried. I thought maybe something has happened to one of the patients. So when I went to the hospital to check, it was nothing. It was the color of her dress, color of her saree. It was red, and this lady kept going to the bathroom, coming out, pouring water, and it was a new saree, whatever. So it was the color of a saree which was seen on the bed. This lady used to use about 50 sachets a day. She used to count 1, 2, 3. She used to finish almost a tanker of water. There's another case, a very interesting case. He was very scared of monkeys. The moment he would see a monkey, he would say that he would get HIV. I tried explaining it a number of times to him and I told him, no, you will not get AIDS because of a monkey. This fellow would not listen. He had a family history of OCD. So he was an elderly man, about 50 plus, but he never would understand even if I tell him that he'll not get HIV. He would go and get himself tested. Almost every week he would go to the lab and have himself tested. So any sort of an obsession becomes a compulsion. They get so scared. Any amount of you explaining things will not work. They need medication. They need counseling after giving them medication. They even need rehabilitation. There was another girl who was sexually abused when she was a child. She grew up, she was married. After that, she started washing her hands and taking a bath at least 20 times a day. She had that sort of a guilt within herself that something bad has happened to her. Somebody has sexually abused her, and therefore she has to cleanse her body. So this also could happen in most of the cases. Dealing with OCD people is not very easy. It takes a long time to help them come out of their problems. They will not understand if you tell them. You have to sit with a lot of patience and explain things to them and divert their minds. Divert it to something different. We had another interesting case. This boy was about 24, 25, and he had a habit of chanting all sorts of things. He used to make his servant sit in front of him, and he used to chant them, and he used to ask her to chant the same thing back. And he used to keep counting 1, 2, 3. Once it so happened that the lady was profusely sweating because she could not get up from there. The moment she tried to get up, this fellow would slap her and make her sit there. Say, come on, repeat it. She had to repeat the same thing around 1,000 times. It is not easy to go on repeating things like this. And the same guy had another obsession that if he sees a dead body on the road, he had to go and see a wedding somewhere. Because he's from Hyderabad, he used to go to the old city and he used to search from every nook and corner. He used to see if there's a marriage going on somewhere. The moment he would see somebody getting married, he would come back and he'd say, okay, these things have equalized. I've seen one death and I've seen a marriage. So this went on for several years. It continued like this. It started when this boy was about 12 or 13 and it went on. By the time we saw him, he was already 25, 26 probably. I happened to see the same guy a few years later. I was driving and I had to stop near the signal light. This fellow comes and parks his car in between the other cars, crosswards. I went on honking because I got the signal to go, but this fellow wouldn't move at all. I said, let me see what's happening. I got down from the car to see, and it was the same guy sitting there. He wanted somebody to chant the same things which he used to make his servant chant. Then the cops had to come, and then, some cop was able to drive his car and he moved the car to the side. And this fellow was taken straight to the police station because the cops did not understand what was happening. I was trying to tell them that this boy is a patient and you have to be very, very careful while dealing with him. But they wouldn't understand this. And finally, we had to give a call to his parents and tell them that this is what has happened. So why don't you go and have him released from the police station? So this is the height to which these people can go to. Every small child, till the age of about 3 or 4, you can see them counting every step. Especially if there are squares on the floor, they go on counting everything. They put their foot and they say 1, 2, 3, they go on counting. This goes off by the time they're about 5 or 6, but in some cases, it lasts. And they become OCDs later. So there's no particular age limit for this. And if there is a strong genetic history of OCD in the family, the other generation could also get it. So when you know that somebody is suffering from OCD in your house, it is always better to be cautious. If you find a little bit of a deviation somewhere where he or she tries to wash her hands or goes on seeing whether she's locked the door, or whether they go on repeating something, or if they say that there's something in my throat, I cannot swallow, I think there are some insects in my throat. So they try to, they spit out water, they just take it and then gargle them out. So when you come across such things, you should definitely take them to a hospital and get some medical help, without which they'll be nowhere. As far as possible, at least to an extent of about 70 or 80%, if you can help them become better, it is good. You have achieved your target. But you have to be very, very patient while dealing with them. Try to explain the same thing over and over again, and especially if they're on medication, they will try to understand what you're trying to tell them. If they're not on medication, and if you try to tell them something, they will not understand. And always see that they divert their minds, they learn something which interests them, some hobby, make them relax, tell them to lie down and do some relaxation exercises which will benefit them, and this, I'm sure, will help these OCD patients. We have come across many OCD cases, and we have tried helping them. We have helped quite a number of them. But you can always expect certain residual symptoms. Say about 20 to 30% of the residual symptoms will remain. You cannot totally wipe it off. But if they are alright to about 70%, be very, very happy that they can manage their lives. If you come across such people, kindly help them by taking them for expert advice. You can also bring them to Prakruthi Foundation, where we deal with a lot of OCD cases. We have a lot of psychologists and counselors who can help them, and that will be really helpful to society. And don't worry about the pandemic. You have to sanitize your hands, you have to wear a mask and maintain social distance, and I think that is enough. Don't overdo things. If you start overdoing things, it could become an obsession, and an obsession could also become a compulsion. So thank you very much for your patient hearing. We'll meet you again next week. Thank you.